So after the implant was taken out, they hope that they can sort of control the infection. Because of her obesity and diabetic status, that was becoming a challenge, and the surgeon had to face multiple problems, during surgery. Particularly one of the surgeries before the last surgery he did, seventh or eighth. He was not able to close the wound, so he had to call his plastic surgical colleague who had to do what is called as a gastrocnemius flap to cover the wound, so that at least he can sort of come out of surgery with a wound closed rather than wound open. So these were the challenges, and then and finally she was decision was made to leave her without a joint, and because of her mobility and no joint being there in the knee, patient was almost bedridden, and she couldn't walk, and she became a big burden to her family, young daughter that she had. We'll continue next.